Well, thanks, Corey. I'm just gonna say, like Don said, there's a bunch of stuff we're working on the end of this, or in regards to this billing project. It will likely mean more clicks. It will for sure mean more clicks. We're gonna automate as much as we can, but I think the advantage with some of the optimizations or things that we're trying to do is the reminders, so that you're not having to look at a reference card so much and remember to dictate something in, but click a box. So, but anyway, that's something that is an active project for the next couple months. We'll have some education around that, I think, in December, and maybe even have another one of these where you can kind of see it virtually on how that stuff will work. So I want to get quick kind of further plug. Please keep attending meetings and coming to these, because this is how we can have some interaction and kind of see how all this stuff works. So thanks, Corey, for inviting me, and I'm happy to kind of improve this workflow because it seems like it was kind of boggled. So here we go. So forgive me, Ludington didn't have a patient in our proof of concept part of Epic, so Blodgett did. So I'm working in my regional facility, I'm seeing this patient. So the new process, basically, you continue your ED work in the same way you always have. You work up patients, you document your note, and ultimately, let's say, for instance, I'm going to say this patient had chest pain just to kind of make it in easy use. So I've cared for them for all their chest pain, and let's say now I'm in a regional facility that does sort of observation and regional stress testing. And I've decided that I want to keep them in order to do that. So my first sort of step around that is place an ED observation order. This is the most important thing you do because this is what initiates all the billing and charges. And if you don't do this, it's all for naught. It doesn't matter what happened. We can't bill for any of the things that you're going to do now. So I'm going to sign that order. Okay. So you can do your typical ED note the same way that you always have. You again exit under provider notes. Forgive my view, I have a bunch of different notes because of all the things I've made, but yours won't look this complex. You should just have, the usual ED ones. The new one that you'll start to see here, though, is this OBS H&P. So anyway, so let's say, again, I did my usual ED process. I even dispoed them. So when I hit that order, interesting things happen. Their status or disposition changes the observation, okay? And then if we look back on their track board, their color changes from pink to purple. And they also generally should flip to this observation tab. I don't know if that's broken now. Oh, it looks like it does. There is a patient there, which is them. So that's actually working. So we pull that up. All those things worked. Inside of my dispo, because I needed to do this for my OBS note, I put in an impression of chest pain, okay? I'll show you why that's important in a minute. So now I'm back to my note. You can launch the ECS ED observation regional H&P right from here. So inside of that, it's pulled in their impression automatically for me. So why I'm observing them. Let's say that impression really wasn't why. You could just delete it and change it to something else in a free text. And then inside of this, we have a bunch of kind of quick hit plans for things that we commonly do. So for this patient, it's chest pain. So we have quick statements about the sort of the standard care that they get for these conditions. Ideally, I would have done the heart score, so that heart score would pull in from my scoring tools if I had completed it. And just sort of some added sort of automated things. What we also have in there is, if this is a PEDS regional observation patient, we have all those conditions that are sort of the agreed upon sort of standardization of plans for those various conditions, and those are all quick links. So, the OBS PEDS headache, that it's just sort of that standard plan that we agreed upon from a regional process. So ideally should save you some time. And then inside of this note is really intended to be a supplemental to your ED note, because when we're billing these, we're billing the highest charge, which ends up being like the observation H&P. So essentially for rest of history, refer to the ED note. For my physical exam, refer to the ED note. Like all those things are pointing back to that original note. So think of this as sort of a supplement to your ED documentation. So I'm going to pause there. Questions about how that works? No? Fantastic.
And I'd like to add, Trevor, just if I could. So
Yeah.
if you have a psych patient, just a FYI for everybody, if you have a psych patient, I think this is where we're going to use it the most in Ludington, but you have, maybe this patient was signed out to you, and 8 hours into the stay, it's decided this patient's going to be here for a couple of days. You can go in and drop down that regional behavioral health note, and it'll refer to that original provider's H&P. So you don't have to redo a whole H&P, kind of fill out these asterisks here, and can kind of get that note done a little more efficiently than we could before.
Right. Like Corey said, you don't need to do a new ED note. You could just drop this. Essentially, think of this as almost like the change of shift, but you're now putting them into OBS. So, all right. So we got our order, we got our documentation. The other part of this are the orders. So for the Ludington flow, we anticipate it's mainly going to be sort of behavioral health. So all of our observation order sets are available to you. We have the one that's the ED observation behavioral health, and that's probably the most useful one. So it's behavioral risk and toxicology. So that might be one to add to your favorites because it has all of the sort of psychotropic medications that we want, and that was built in kind of parallel with our sort of empath workflow. So it's, again, a standardization of sort of that order set, and a good amount of quality work sort of went into that. So that's one I would push you to use because I think it would be helpful. So, all right. Anyway, so we're going to kind of move on. So inside of that, sometimes these patients are there for several days, and eventually they do get a med reconciliation. So the process at Ludington, forgive me, Corey, is that someone informs the clerk and then the clerk initiates that process?
Yes. So after you put the after you do your observation order, just let whoever the clerk is know to do a med rec on them. As soon as the patient turns purple, they should be automatically doing this regardless.
Great. So, that's something that gets done later on, like after they've been placed in observation, we've been seeing them for a while. So my kind of cue would be, okay, my shift's ended. I did put a patient in OBS. Ideally, this has now happened. Now I could go in there and do the full med reconciliation for these patients because now that sort of list is available. And your cues will be these colors that are along that observation tab. Okay, so kind of fast forward through that, so now I've done basically all of the first day care. Let's say that, so this behavioral health patient is sitting on a second day because we didn't get any placement. We built out a progress note for you, but I'd also say we're thinking about adding another tab that's going to be down here that says observation that would give you access to that note as well. But for right now, you get this through the observation tab, and there's an OBS progress note that we have that you can easily utilize, and it's pulling in, again, the same sort of stuff. And these are just very, very generic notes. You'll know that you're in the right note because you see the ECS sort of logo on it, okay? So pulling in their primary problem, basic assessment and plans, basic subjective history, and then it has the usual review of systems and physical exam block that you're used to seeing. So come 2023, billing for observation is kind of going to more of an inpatient standard. So we still will require a review of systems and physical exams on sort of those continued observation patients. So again, in those blocks are still available inside of the documentation for the note. So, but pretty simple documentation is what's really required here, and we don't anticipate that is a big lift. So that's how the progress note works. And then, sorry, I'm having dueling screens messing me up. And then lastly, under the discharge summary, this is where you'll find your discharge summary. But I would say there's nothing magical about doing discharge orders out of the observation tab versus doing it on the dispo tab. So let's say, I did want to just discharge this patient from here. So chest pain observation, which I'm attaching these instructions. I'm going to have them now be discharged. and I'm going to have them follow up with their, say they don't have a PCP, I'm giving them the referral phone line. I'm going to say call, okay? And they're ready for discharge. So I do have to access my documentation through this part of it. So I'm going to launch my new sort of observation discharge note. But all the things pull in that I made inside of the Dispo tab, which we're also very used to using because we use it every day. The one caveat here is I made on this note, this discharge date and time. It's a bit, so it'll pull in the date as the date I launched this note. You need to put in the time as the sort of when you decided to discharge them. So that's something I couldn't automate, mainly because oftentimes we're documenting after the fact, and there's not a way to like pull in, there's not an order that's made when you discharge a patient to pull in a discrete time. So make a note of when you do discharge them, or look back in the record of when the nurse released them to put in that specific time of when they really left. But inside of this, again, it pulls in that admission diagnosis, and discharge diagnosis will be the same as that one. If you wanted to do something different, you could delete it and then replace it. So that is still an option to do that. And then around outpatient follow-up, it's pulling in, yeah, I put in the referral number. It still has a physical exam block because that's still something required for discharged observation patients. And then their vitals pull in, and then a kind of traditional observation course. Inside of this, we have a couple, again, what we think are will be helpful statements to you. So again, if you were at Blodgett and this is a cardiac patient, essentially it's they either had a negative stress test or they had a positive when I'm transferring them for a heart cath. But for the case of like behavioral health, just some standardized language around kind of what we did. We managed them OBS. Eventually they were arranged for transfer to an accepting facility, and then some wild cards for some additional documentation. So, you know, all of this is really intended to save you time, but you don't even have to use that. It's an optional statement. You could still just wildcard free text your whole sort of course, and that is fine and acceptable as well. And then once I sign my note, essentially I'm done.